Welcome to the channel. Myself, Dr. Shanmugavadivu, Assistant Professor, Department of Biochemistry, SRM Dental College. Today we are diving deep into the world of ketone bodies, those tiny but mighty molecules that your body turns in when glucose is low. Ready? Let's break it down. What are ketone bodies? So called because they have keto group in their structures. They are water soluble and energy yielding. The reference range is zero point 0.6 to 1 milligram per dl. These are the ketone bodies: acetone, acetoacetic acid, beta hydroxybutyric acid. The acetoacetate is the main one, and beta hydroxybutyrate is the close cousin. Acetone is a smelly one that gets exhaled. Acetoacetate is the primary ketone body, the others are formed from it. These are the structures of ketone bodies which have a keto group in their structures. The other name for beta hydroxybutyric acid is beta hydroxybutyrate. These are the clinical states of ketone bodies: ketonemia, ketonuria, ketosis, ketogenesis, ketolysis. Ketonemia is excess of ketone bodies in blood. Ketonuria, excretion of ketone bodies in urine. Ketosis, both ketonemia condition and ketonuria conditions called as ketosis. Ketogenesis is the formation of ketone bodies. Ketolysis is the breakdown of ketone bodies. Ketogenesis. Ketogenesis is the formation of ketone bodies. When you are starving or having uncontrolled diabetes, glucose levels drop, so the body breaks down fats into acetyl-CoA. Too much acetyl-CoA overwhelms the TCA cycle, so it's rerouted to form ketone bodies. All of this happen in the mitochondria of these liver cells. These are the metabolic reactions of formation of ketone bodies. Two molecules of acetyl-CoA in the presence of thiolase enzyme condensed to form acetoacetyl-CoA. Acetoacetyl-CoA in the presence of the enzyme HMG-CoA synthase, it forms an HMG-CoA. It's an regulatory steps in this synthesis of ketone bodies. And this formed HMG-CoA in the presence of the enzyme HMG-CoA lyase, they form an acetoacetate and one molecule of acetyl-CoA are released. This formed acetoacetate is the primary ketone bodies. From this acetoacetate, both its beta hydroxybutyrate and acetone are synthesized. This acetone are synthesized by the spontaneous decarboxylation reaction. So here, this formed acetone exhaled through the breath. Next. Ketolysis, how they are used, that is utilization of ketone bodies. Now, who uses these ketone bodies? Not the liver or red blood cells, but your brain, muscles, heart and kidneys do. During prolonged fasting, up to 75% of brain's energy comes from ketone bodies. Here that energy yield is 1.5 ATPs per ketone bodies. That's the power. This process explains the ketolysis, oxidation of ketone bodies in extrahepatic tissues. This beta hydroxybutyrate is converted to acetoacetate in the presence of the enzyme beta hydroxybutyrate dehydrogenase. This acetoacetate is converted to acetoacetyl-CoA with the help of the succinyl-CoA, and thus succinate are removed. Here this happens in the presence of the enzyme thiophorase, which is absent in liver. This acetoacetyl-CoA further cleaved into two molecules of acetyl-CoA by the enzyme ketothiolase. So that regulation and ketosis. In starvation or diabetes mellitus, glucagon level rises. This blocks glycolysis and promotes gluconeogenesis, lipolysis, ketogenesis. This leads to ketonemia and ketonuria, that is a ketosis. Metabolic acidosis and Kussmaul's respirations. Ketones like beta hydroxybutyrate are acidic. Too much of acidic beget an a metabolic acidosis. Your body compensates by breathing hard and fast, called Kussmaul's respirations. So that typical acidotic patients will have breathing due to compensatory hyperventilations. Also, the breath may be smell like an acetone. It's a warning sign for the coma stage. Diagnosis of ketosis. To test for ketosis, we use Rothra's test and urine strip test, simple non-invasive ways to detect these ketone bodies. By in this Rothra's test, the purple coloring confirms the presence of ketone bodies by these Rudras powder and ammonia hydroxide. The strip test shows that different colors shows that presence the level of ketone bodies. Next, conditions of overproduction of ketone bodies. In diabetic ketoacidosis, glucose cannot enter cells. Oxaloacetate is diverted to gluconeogenesis, so acetyl-CoA builds up. This means more ketones, more acidity, and risk of coma. Breath smells fruity from acetone. So here, that uncontrolled and untreated diabetes mellitus, low carbohydrate and high fat diet, prolonged starvation and fasting leads to the overproduction of ketone bodies. The brain survives on ketones. That's your body emergency backup systems. Diabetic ketoacidosis. As oxaloacetate is diverted for gluconeogenesis, the TCA cycle cannot consume all the acetyl-CoA. Hence, more acetyl-CoA is converted to ketone bodies. This leads to ketosis. The accumulation of acetone, acetic ketone bodies lowers the blood pH. So, metabolic acidosis occurs. Smell of acetone in the breath is noticed that may lead to coma. Here is the same conditions for the starvation. In starvation mode, glucose is low, fat is broken down, acetyl-CoA forms ketone bodies, and guess what? The brain survives on ketones. That's your body's emergency backup system. These are the short notes for the ketone bodies, how that clinical significance of ketone bodies occurs in a simple form. We can easily write that insulin due to the insulin deficiency, that level of glucose uptake by cells is decreased, and due to this starved conditions for glucose, this leads to lipolysis, and this lipolysis leads to increased fatty acid degradations. So finally we got that excess amount of acetyl CoA, which is the main one for the formation of ketone bodies. And then the same starvation condition, the glucose level is reduced and increased fatty acid consumption that leads to excess amount of acetyl CoA. Acetyl CoA not handled by the TC cycle due to the deficiency of oxaloacetate. So here that excess of acetyl CoA involved in the formation of ketone bodies. So these are the simple steps to memorize that ketone body synthesis and utilization of ketone bodies. So finally, in this 21.5 ATPs are produced by beta hydroxybutyrate, 19 ATPs are produced by acetone. That's all about this ketogenesis and ketolysis, ketosis. Thank you for this.